The Regina-Capel Health Region has adopted the Influenza Immunization or mask policy. This policy has been adopted and implemented by all health regions across the province. The new policy is part of the region's commitment to patient safety. The Influenza Immunization or mask policy requires that all RQHR employees, other privileged credentialed professionals, resident, volunteers, students, contractors, and vendors who attend a patient contact location must either choose to be vaccinated annually against influenza or wear a surgical procedure mask during influenza season when in a patient contact location. Vaccination required date. The date established annually by the Chief Medical Health Officer, after which all persons covered under this policy are required to either be vaccinated against the influenza or wear a mask. Typically, this is from late November to late March, but depends on actual circulation of the influenza virus each year. Vaccination required period. A period of time determined by the Chief Medical Health Officer and starting on the vaccination required date. The vaccination required period will usually be from late November to late March, but depends on the actual circulation of the influenza virus each year. During the vaccination required period, covered individuals will be required to be vaccinated against influenza or wear a surgical procedure mask. Responsibilities. Your responsibilities under the Influenza Immunization or mask policy are: you must annually advise RQHR of your influenza immunization status in the manner acceptable to RQHR by vaccination required date or wear a mask. During the annual vaccination required period, which is determined by the Chief Medical Health Officer, those who are not vaccinated against the influenza are required to wear a surgical procedural mask provided by the RQHR while at a patient contact location. Individuals required to wear a surgical procedural mask will be responsible for maintaining the mask in good condition and in accordance with the RQHR protocols. During an influenza outbreak in an RQHR facility, this policy is suspended at the outbreak location and the RQHR's outbreak policies will apply. If you witness any instances of non-compliance with this policy, you are expected to report the incident of non-compliance immediately to your supervisor. It is expected that staff will comply with this policy. Performance management measures will be used to address non-compliance with this policy. All immunized staff will be given a sticker to place on their ID badge, indicating that they have been vaccinated. Staff without a sticker will be required to wear a mask. Healthcare workers immunized at work will receive a sticker from their employer to place on their identification badge. If a healthcare worker is immunized at the public health clinic, they will receive a card verifying their immunization, which is to be provided to their employee health nurse, who will then provide them with a sticker for their identification badge. Patient contact location includes any building, property, or site owned, leased, rented, or operated by RQHR, where there are patients, residents, or clients who are receiving health care, and any patient, client, resident home, or other location where covered individuals interact with and or provide health care to the patient, client, resident in the course of his or her work for RQHR. Patient contact location does not include any area where a patient, client, resident would not typically be seen, administrative areas or private offices which are not generally accessed by patients, residents, or clients, facility maintenance areas, shipping, receiving, and distribution areas, classroom, training areas, cafeterias, designated staff rooms, staff lounges.